The Argus 2001 used this certified rodent diet 5002, which is soy-based. And I found no rationale for the use of that diet, and it's not, in fact, one that I'm familiar with in toxicity studies. In fact, this is the first time I ever encountered the use of this diet in a toxicity study. And it appears to me to have been an unfortunate choice, given the fact that this whole study is about thyroid physiology, to have used a soy-based diet, which is known to contain goitrogens. And so, unless data can be developed that would indicate that that diet itself had no effect on the thyroid, and now there was no overt effect. None of the animals that got, just the diet alone exhibited any thyroid pathology. I'm not saying that, but it could have put these animals in a compromised situation where the addition of further impact on thyroid physiology would be more exaggerated than otherwise. And this is just speculation, I admit that, but it's something that I think needs to be considered. I think it might be an appropriate point to call attention to the profound difference between rodents and humans in terms of thyroid physiology. The rat has a much higher basal metabolic rate than humans. It's consuming 10% of its body weight in food every day, and the whole thyroid is operating by many parameters at about a level of 10 times that of humans. And perturbations in the thyroid economy of a rat get translated into a much greater magnitude than in humans. And so if this is saying, do you expect in humans the same kind of effect that you get in rats at a certain level of exposure, I would say emphatically no. Accordingly, there is no compelling reason to believe that perchlorate would cause thyroid cancer in humans, particularly at currently reported levels of exposure. You could eat a dish of broccoli and get about the same level of thyroid inhibition from thiocyanate as with these levels of perchlorate. But I think this Croak study shows to me that individuals can have quite substantial levels of perchlorate consumption without impairing thyroid function.